visited the United States and spent $21 billion. Obviously, when the pandemic hit and there were restrictions on the border imposed in March of 2020, extending through 19 months. Obviously, the economies of both the United States, in Canada, Western New York, and Southern Ontario have taken a major hit. So all of those losses now have the potential to be gains, and we want to move as quickly as possible. This opening will be done in two phases. One will start, again, sometime in November, with allowing Canadians who are fully vaccinated to travel into the United States without a testing requirement. The problem with that is they may be reluctant to take that trip because upon their return to Canada, the Canadian government does have a testing requirement. They have both a vaccine and a testing requirement. So we believe, and I will be urging the Canadian federal government to take a look at that and go with the U.S. model, which provides for only fully vaccinated could pass into the United States and hopefully back into Canada. The Western New York economy is profoundly influenced by the Canadian consumer. They come here, they spend money. 30% of those who use the Buffalo Niagara International Airport are Canadian citizens. Canadians spend $15 million in healthcare in Western New York alone. And our two professional sports franchises both depend on the Canadian customer base, season ticket buying base, fan base to support our teams, our retail economy, higher education. And the same is true with the Western New York U.S. impact on the Canadian economy. Southern Ontario and the province of Ontario itself is the fastest growing, largest province in all of Canada. Nearly 40% of the entire population, 38 million people in the entire country of Canada live in Southern Ontario. So about 40% of that. So the White House is doing a press briefing this morning at 11 o'clock, and we're hoping that they will be clear about the important detail that's still left to be discussed so that people will have a full understanding of what the change in policy. I think we really missed not only an economic opportunity, but a life quality opportunity. People who love each other, family members, were separated for far too long, unnecessarily so. The fact of the matter is this messenger RNA technology is very powerful. It's the efficacy rate is 85, 90, 95%. When biomedical researchers originally were trying to develop a vaccine, they were hoping to achieve an efficacy rate of 60%. These are 85, 90, 95%, which just underscores how important they are to helping us get back to a sense of normalcy.
Travel was, pre, post restrictions. And why do you think the administration finally decided to move now? As you point out, Canada lifted the restrictions back in August. What finally convinced the administration that this is the right time?
First, on the statistics, in 2019, the year preceding the pandemic, 21 million Canadians traveled, visited the United States, and spent almost $21 billion with a B. That's $1.75 billion a month for the entire year in 2019. That number took a major hit because only essential travelers, who, by the way, were unvaccinated for the entirety of that time, or at least did not have a vaccine mandate imposed on them. So a lot of them presumably were unvaccinated, were crossing the border every single day. I think it was the pressure. I mean, if the White House, from the president on down, and the Centers for Disease Control and Prevention talked about the power of this vaccine from both giving and getting COVID, that had to be recognized somehow. So if you look at the CDC guidance on COVID, it says clearly that if you're fully vaccinated, you can return to most pre-pandemic activity. For those who live along the border, that includes being able to cross the border if you're fully vaccinated. So the other thing that was odd was that each and every month, the United States federal government and or the Centers for Disease Control and Prevention would state that the border was going to remain closed without any kind of engagement about, metrics or what efforts were being made toward the goal of opening the border. That was the situation for most of the past 19 months. That's a tremendous disservice to people who depend on moving back and forth between the borders, including loved ones who were separated. I think political pressure had something to do with it. And you can't, on the one hand, talk about the importance of vaccines, ignore the fact that people that are fully vaccinated could not cross the border. You have almost 73% of Canadian adults are fully vaccinated. About 56% of U.S. Adults are fully vaccinated. And, the other issue is this. If you, leased a helicopter in Fort Erie, Ontario, and you flew it to Buffalo, you're fine. But you can't get in a car from Fort Erie, Ontario, and drive to Buffalo. That makes absolutely no sense. There's no science that says that you're safer in a helicopter than you are in a car. So I think that the White House, over time, I personally have appealed directly to the White House, as have others. Their position was not sustainable. And if you're really talking about celebrating the great progress of the messenger RNA, it's the genetic material that tells a cell to make a protein, which is the active ingredient in the vaccine, and tested rigorously for both safety and efficacy. And when you achieve results that are 85, 90, 95%, that is a hell of an achievement. When, biomedical researchers originally went into this, thinking the development of vaccine would be much longer to accomplish. But secondly, they were hoping to achieve an efficacy rate of like 60%. The seasonal flu vaccine in the United States is about 40% effective. So I don't think enough was made of the strong immunity that one gets from these very, very powerful and safe vaccines. When I mean strong immunity, from getting severely sick, avoiding hospitalization, and a lethal outcome from COVID.
Hi, Congressman.
Yep.
Hi, Alex Panetta here, CBC News.
Hi.
Thanks for taking our questions.
Yep, happy to do it.
Wanted to ask you about the idea of changing the test requirements in Canada, because as you pointed out, a lot of people wouldn't be able to, doesn't move. Like, for instance, could there be ways of setting up, exit testing stands or anything within the United States to help, not disincentivize cross-border travel?
Yeah, look, we're all economic actors. And when we're confident, we move. And when we're not, we don't. And that's also true for border economics. We see it time and again. And when there are physical, in this case, a border that's closed to Canadians from entering into the United States, or there are administrative barriers, people are less likely to move. And we want very much people, we want those folks to move. And the fact of the matter is, and many in the United States, including the president, has said that this is a pandemic of the unvaccinated. So that says to me, and I think to a lot of people, that if you are vaccinated, that has to account for something. It has to be acknowledged. It has to be recognized. It has to be celebrated and embraced. So is the testing requirement absolutely essential? I would say not. I think that the existential, the standout criteria is if in fact you have been vaccinated fully. And if you have and you can certify that you have, then that should be what is necessary in order to cross the border. And I think testing is redundant. And again, I think it will lead to a lot of Canadians that will be reluctant to come into the United States that don't have to be tested because they know upon their return to Canada, they have to be tested. So there's a cost associated with that, but it's also an additional administrative step that I think is unnecessary. So what we will be doing, as we have done throughout this, is continuing to communicate with the Canadian federal government, just raising these concerns, and what should be a current concern on both sides of the border.
And I'm just wondering whether you've, already managed to talk to anyone from Canada about this, and just wondering if you've heard anything.
I have, but I think this is a decision, again, like all of these decisions are made by the principal governmental leaders. It's made by the Prime Minister in Canada. It's made by the President of the United States. There's a lot of people that are working within those structures to help, gather information, analyze that information. But in the end, the decision will be ultimately made by the Prime Minister. So, my hope is that the U.S. policy will help influence a rethinking about the testing requirement. And we're going to raise that in letters that we will be sending to the Prime Minister and legislative leaders, members of Parliament.
Thank you very much.
Hey, Congressman, this is Basil John with Next. Can you hear me?
Yes, I can.
Perfect. So I know that you and many of your colleagues up in New York, both Democrats and Republicans, were incredibly outspoken. Can you further emphasize what you think about the importance of getting pressure from both the administration, getting pressure from both sides, both Republicans and Democrats, not just from New York, but from other states as well who were affected by this border situation?
Yeah. Well, I represent Western New York, which includes the city of Buffalo and the city of Niagara Falls, New York. 10.5 million people from Canada crossed at the Buffalo-Niagara Falls border crossing in 2019. This year was under 2 million. So the community that I represent is profoundly influenced by the closing of 120 land ports of entry. So, my voice of frustration was that of the frustration of the people that I represent, whether they owned cottages in Canada, whether they were separated from loved ones, whether they were trying to conduct business. So, I think that political pressure is part of this process. And, it's like you're all journalists. You're in both the heating and lighting business. You provide light relative to your, investigation of various issues, but you also apply pressure, a heat to move, elected officials in a direction that they ought to be moving in. Same is true with, members of Congress or members of Parliament. We have constituency, and we fight as hard against the federal bureaucracy as anybody. So, I think, logic was on our side. The arguments that I was making and others have been making have been based on fact that we've all been admonished to follow. And I found throughout this, and I think many of you reported on this, and you found independently, that there was an inconsistency in the policy that is based on science and fact, and the practical policy of continuing the border restrictions for the extended period of time that they were imposed and still are imposed. And that's, as I said, it's a huge economic loss. It's a huge life quality loss. And it's an emotional loss as well when loved ones are separated despite having been fully vaccinated. So I literally had thousands of people that couldn't understand that despite the fact that they were fully vaccinated, they still couldn't move. and they were rightfully frustrated. And I, on their behalf, individually and collectively, had to voice that frustration to the White House many, many times. And, eventually I think that that collective activity of other elected officials finally, forced a reconsideration of the policy that resulted in the announcement that was made late yesterday.
Thank you.
Any other questions? Okay, thank you very much, everybody.
Thank you.